and welcome to Joy in Our Town. I'm your host, Lisa Ranieri. Today we have Dr. Tunde Komolafe and Pastor Ezekiel Petway here to talk to us about different heart diseases and how we can help prevent and help take care of our hearts. How are we doing?
Okay.
Good morning.
Good morning.
Doing good.
Can you tell us a little bit about the different types of heart diseases that we have here in Montgomery?
Here in Montgomery, Alabama, we have some occur very frequently and some are not. The most common, obviously, hypertensive heart disease. Basically, your heart's working against a high blood pressure and it gets enlarged over time. And also very common is what's called congestive heart failure. Basically, your heart cannot supply the metabolic demands of your body. We have pretty much two different types. Caucasians kind of have what's called ischemic cardiomyopathy. That's you have a blockage in your heart, and then the heart gets weak over time. And other people have what's called non-ischemic cardiomyopathy. Basically, you don't have any blockages, but you have high blood pressure. The heart gets weak over time. Another very common heart condition is atrial fibrillation. Basically, the top part of your heart is not squeezing properly. And then that there's a risk of a stroke over time if you're hypertensive, diabetic, and also if you have, the older you get, the more common atrial fibrillation is. And that's pretty common. Now we have some that are not very common, like some cardiomyopathy, genetic disorders, that's basically your heart muscle is enlarged just for genetic reasons. And that's usually more familial, goes in the family. But by and wide in Montgomery, since I've been here, it's been heart failure, hypertension, and atrial fibrillation.
Okay.
They're the most common kind of heart diseases we have.
Okay. Within this past year, like you said, that's what you've seen. Has there been an increase of like heart attacks that might lead to deaths because of people not taking care of their hearts?
Yes, definitely. I've been, started here in Montgomery 9 months ago, and it's what I see every day. Cath lab yesterday. Now, heart attacks have a different spectrum. There's one like the artery is completely closed, and we have about 90 minutes to go in and open that up. After 2 hours, basically, the heart goes into, there's no blood supply, and you're either going to cardiac arrest or you go into bad heart failure. And people just go into a cardiac arrest and die. So that's the most serious type. So if we get called for that, we have 90 minutes to open up the vessel. We have some that's not just chest pain, that's not as serious as the first one, but heart attacks happen every day. Like now, going back to work, I have about 4 or 5 cases lined up for me. So it's something that occurs every day, and some lead to death, but we have better equipment now. We have heart stents, we have balloons, we have impellers, we have pumps, we have things to support the heart. So the mortality rate is actually lower than it used to be several years ago.
Wow.
Yeah, we have a lot of equipment now, and people are living longer and doing better because of some of the things we do for them.
Okay. Let's talk about the difference between men and women. I know there's a lot of difference between each of the sexes. But what are the difference with heart disease for the male and females?
All right. Well, basically, for women, diabetics, and elderly people, there are 3 classes of people that don't present the typical way. Everyone knows if you have chest pain, break out in a cold sweat, you're having a heart attack. Even a 5-year-old boy knows that. But women, diabetics, and elderly, they have what we call atypical symptoms. Basically, they could have like heartburn. They feel they have acid reflux. Elderly people, sometimes they feel like they just have fatigue, they're just tired for just no reason. Another very common symptom is just shortness of breath. Like you just cannot, you don't have chest pain, but you try to walk from here to the bathroom, you get very short of breath. And sometimes you just there's shortness of breath, you feel fatigued, you think you have heartburn. And so for women, and the main reason, there are a lot of reasons, but basically women tend to have more autoimmune diseases where your body literally tries to attack itself, and that leads to like a lot of inflammation, and inflammation can lead to heart disease. And also when women get a menopause, there's a lot of hormonal changes going on, and that upsets the balance, and there's a higher incidence of heart disease in women after the menopause. So there's a lot of factors that go into play, but yes, but when a woman, a diabetic person, or an elderly person just tells me they don't have chest pain, but they just can't describe what they have, then my antennas kind of go up.
Okay. Well, let's turn it back to you, Pastor Petway. Can you tell us a little bit about your personal dealing with heart disease?
Yeah, actually, December 26, 2014, a normal day for me would be 4 or 5 mile walk. So on December 26th, I set out for my 5 mile walk, completed it. But when I finished the walk, my chest was burning and it was hurting a little bit. So I figured I just walked a little too hard. So I continued through the weekend, and I said I'll walk Monday, and that was December 29th, 2014. And actually, a half a mile into the walk, I had chest pains that was so difficult that I had to stop where I was. It literally stopped me in my tracks. So I had to turn around and make it back to my car. And that was the beginning of what I thought was acid reflux. And just long story short, it took from 29 December 14th until February 2nd of 2015 to figure out what was going on. The whole time I thought that I was having acid reflux, and had gone to the hospital in different places and learned that I had this problem with my heart. I had a blockage. And so I ended up seeing a gastric doctor. She referred me to Dr. Komolafe. I saw her on a Thursday, which was still in January, like January 28th. And I ended up seeing him on February 2nd. And on February 4th, he unstopped the artery. And this had gone on for nearly about 40 days. Some of the symptoms I had was shortness of breath, could not really do any physical activity at all. If I walked from my house to the mailbox, I was out of breath, couldn't eat any food really. Had begun to drink just Boost or something like that because I couldn't digest anything because I needed oxygen, and it was just hard for me to digest food. And so I didn't know what was going on until I got to him.
Okay. What do you think helped him get to where he is today? Like, he's not dead, because heart disease is like, it can escalate pretty fast.
Yes, it can. I've seen him in the clinic on several times. So within the limits of what I can talk about, it is by God's grace that he's alive today. As in, I'm a doctor, I'm a Christian, so I can literally say that. Because what he had was his LAD, that's the left anterior descending artery that supplies about 60 to 70% of blood supply to your heart. Right at the very beginning was just chopped off. As in, people usually just go into cardiac arrest, go into bad heart failure, and he's had the symptoms for, like you said, 40 days. So I saw him in the clinic. He had a stress test. Stress tests are pretty good. But again, the sensitivity and specificity, all that means is like 80%. So that means like out of 4 out of 5 people, it's going to be pretty accurate. But 1 out of 5, it could tell you there's nothing wrong when there's something wrong, or it could be the other way around. So he had a stress test that said was normal, but he kept having symptoms. Like, again, acid reflux, people think they have acid reflux, but he did an endoscopy, and that was normal. So when I saw him in the clinic, saw his EKG, he had some changes that I was concerned about. But again, within limits, sometimes people have just changes and they're normal because sometimes they're obese, so the heart doesn't send the signals out because of all the fat. So those changes could be due to obesity or it could be due to COPD. But let's go and take a look at your heart just to be sure, because, and it wasn't the cath lab, it was doing it through his hand, some new techniques of radial artery. And I can remember me and my staff were kind of like, it's a light atmosphere, talking and getting the work done. We took the first picture, and the whole room just like, we were surprised. So then things picked up, and then we like, all right, let's move in. So it took us like an hour or so. Got a wire down, got a balloon down, got a stent down, good flow. And what's even amazing is usually we have to open up the artery within 90 minutes, and after 2 hours, the heart starts getting irreversible damage. He's probably been closed for several days, and his heart function still was. I could see a little effect, but definitely his heart was not barely damaged. So how that happened, I cannot explain it. But he's doing well today, and I'm happy that everything turned out right. Heart disease, basically, the first treatment that as doctors, like there was a study, the American Heart Association that did a study and said there are 7 matrices of heart health. First of all, not smoking, normal blood pressure, normal cholesterol, a normal body weight, physical activity, normal cholesterol, and normal glucose. And they found like people that had all those 5 out of 7 of those matrices, compared to those that did not have it, they had a 75% reduction in mortality. That's a 75% less risk of dying. There's no medicine, there's no intervention in medicine that can do anything that dramatic. Even a heart stent doesn't reduce mortality by 75%. So by and large, the medicines and the interventions we do is just an added advantage, but the main thing is lifestyle. As in, you just can't beat that. A 75% reduction in mortality. So basically, they have to watch their blood pressure. They have to be in a normal BMI. That's a body mass index. They have to quit smoking. They got to get the blood glucose, the diabetes well controlled. Because even if you put a stent in your heart and your sugars are way up, the stents are going to just re-occlude. So, apart from lifestyle, the other things we can do, like I'm an interventional cardiologist, so we put wires down vessels, we put balloons down to open up the vessel, we can put stents there to keep it open, and we also can put defibrillators in heart failure patients, so if you go into cardiac arrest in your room, wherever you are, it senses that and shocks you and brings you back rather than you're passing out from a cardiac arrest. So we have defibrillators, we have pacemakers, so people are living longer by nature of what we do. A host of other things. Now we have ways we can replace the heart valve through the skin without open heart surgery. I've done some of them in Michigan State. We also have new methods of closing up holes in the heart without opening up the heart. You can actually go into the skin and close up the hole in the heart without open heart surgery and can go home the following day. So a lot of therapeutic interventions we do, but by and large, lifestyle modification, beats everything else, basically.
All right. So on average, how much longer can people who have a healthier lifestyle and exercise on a daily or moderate basis have a chance better than people, or more than people who don't do anything?
Yeah, for a rough answer, I would say like an extra 10 to 20 years. I don't have the exact statistics, but like I said earlier, people that have very physical, they cut their rate of their risk of dying by 75%. So basically, you live longer, you feel better, you have apart from the quantity of life, your quality of life is even better because you can do a lot, play with the kids, the grandkids, your knees don't hurt. So you live longer, and even the quality of the life is actually better. So you can't beat that.
Thank y'all for coming.
All right, thank you.
No problem. And stay tuned for more of Joy in Our Town.